Now, for people that are interested in that surgical procedure and really going that extra step, because what we talked about with laser and with the PRP are wonderful additions and can absolutely, push you in the right direction. But for someone with true, baldness or a large area, the
Sure.
surgical option is probably the best, correct?
Yeah. So if the follicles are beyond repair, they're producing a hair that's not visible to the naked eye anymore, less than 2 millimeters. That's considered vellus hair. Those hairs are beyond repair, or if the follicles are simply not producing anything whatsoever, like in a hairline, the PRP, medical therapies, nutrition, laser, all of that is not going to help you regrow that hairline. So you're going to need to move some hair follicles around, and that's what hair transplantation does. We do it differently than years ago. It's no scalpel, no stitches anymore, no linear scar. We're using exclusively the gold standard, which is FUE, follicular unit extraction. And my practice, that's been this, what we've been doing exclusively for well over a decade, probably almost 15 years of just FUE. And so that methodology enables us to take the grafts one at a time from the back of the scalp. So there's no linear scar. And the grafts contain as little as a single hair follicle. So I have unique control over creating a soft and natural hairline to reframe the face in an aesthetically pleasing way that doesn't look like it's been transplanted, but looks normal and natural. And of course, when you don't have stitches and you don't have staples, you're going to heal much faster, much more comfortably. So the back end of the procedure is the recovery time is so much shorter and a lot less restrictive. And of course, gives you that flexibility of wearing your hair as short as you really want to, without any visible linear scar left behind that gives it away, so to speak.
Yeah, it's really crazy how much of an art form it's become, right? Because I remember, listen, back in the day, it used to be hair plugs, right? And it right away. It'd be incredibly visible for everyone.
Right.
And that's what, for a very long time, we thought hair restoration was. And it's advanced so much more. And I love that you're using all these different techniques, from the laser to the PRP and I would be remiss if I missed out on a few that absolutely probably have some role in this.